Welcome back on the program. Now it's time to talk something different, looking at the health sector this morning. Behind every well-functioning health system is a team of people who make care possible, not only doctors and nurses, but also support workers, caregivers, and community helpers who ensure that every patient is seen, guided, and comforted. In Nigeria, these individuals form the invisible backbone of the health sector and the wider care economy. Now, the care economy encompasses the paid and unpaid work that supports people's health, education, and well-being. In Nigeria, millions of individuals, mostly women, perform underpaid care work daily, looking after children, the sick, the elderly, and those with disabilities. Now, joining us for this conversation is the founder and CEO Caring Africa, Blessing Adesiyan. Good morning.
Good morning.
Thank you so much for joining us on TVC Breakfast Saturday. Talking about health sector at the moment, and there's this report that says that about 15,000 nurses in Nigeria left the country in February. These figures are alarming. From 2018 to 2025, we've seen a record of about 16,000 doctors leaving the shores of Nigeria for foreign practice. Is this a developing and a worrisome development in Nigeria?
Oh, absolutely. It's not just a brain drain, it's a care drain, because as we know, Nigeria is on track to be the third most populous country in the world, behind India and China. And so if we are on track to essentially become about 400 million people by 2040, and we don't have the right people to care for this growing population, then you and I are not going to be in a good place in 2040. That's really what is happening. And so it also speaks to how do we value care in our society? And how do we even value the care of a professionalized care workforce? One of the things that I fight for is professionalizing and formalizing our care workforce, nannies, housekeepers, and so on, and adult caregivers. But then we look at doctors and nurses who actually have professional degrees, and if this is how we treat them as a nation, what does that say about how we fundamentally value care?
Okay, that's actually really interesting. You actually went there, talking about the fact that, I mean, here, we still have doctors and nurses literally still dragging for their salaries to be paid and things like that, right? And then I'll talk about the people, I mean, not in that group. Do you understand? We have a lot of, as he said, a lot of care workers leaving the country. So it's interesting that out of the country, we have a lot of focus on care, right? People are leaving here to go and do care, whether they are in the care sector or not. Do you understand? Now, then that's literally leaving a gap right here in Nigeria. How best would you say we start to fill that gap? Because whether I like it or not, people think that they get a better life outside, but we have the elderly here who are here and will be here. So how can we start to fill up that gap?
Well, I mean, I think that the problem that I see here is that we don't have a system. We don't have a care system that works. And so it's going to be incumbent on government and even the private sector to really think about what is the strategy here to ensure that we can keep the professional care workforce occupied and paid well. We just heard him talk about the underpayment in the care sector. Why is that so? And you know, we've talked about this before on multiple platforms, how, you know, so many of us just jet off to London, to America, to go get health care, you know,
true.
and then we come back here and we're like, oh, all is fine, and we're not investing in the care system that will actually help us collectively as a nation. Now, when we talk about those nurses that left, those nurses are not going into a nursing degree or a nursing they're not practicing nursing.
Absolutely.
Or doctors in the US or in the UK. They are actually going into the rudiments of care work. You know, taking care of the elderly there, taking care of persons with disability there. And so what does that tell us? It tells us that these people are taking the care of their own people seriously, and we are not.
And that's what you are doing here in Nigeria. So what inspired you to start with this great initiative? Start with care, and what innovations are you bringing on board?
Absolutely. I mean, so that fundamentally answers the problem that we just described. We have to start with care. if we want to support the well-being of our people, if we want to catalyze the economic growth of this country, if we want businesses to actually thrive, it just makes smart economic sense for us to invest in the care of our children, our aging adults, especially as the population takes off. I mean, in 15 years, we've done nothing. This entire economy is going to crumble. And Europe gets it, which is why they are all scrambling to grab our people. And we are here thinking, oh, you know, all is well, all is well. Well, in 15 years, if we do nothing and we continue to see diseases and children falling off and not making it to 5-year-old, our aging adults, the life expectancy in Nigeria is 54 years old. Do you know that? We've actually scaled back from 57. So by 2040, it's dropping. And so we need to take our health, our care, and our longevity seriously as a nation.
So, okay, so it's interesting that I know, reading your bio, literally you didn't school in Nigeria, right? So it's interesting that to see that you went out of here to school and then come back here to invest here, which is very, very important, right? And also, if you look at your I mean, even the field you specialized in, not necessarily care related, right? However, you've picked this interest. Why is that? And then back to my first question, what can we do?
So one of the things that, my background is actually in chemical engineering.
Yes.
Worked for 4 Fortune 100 companies in the US for 15 years.
Yes.
But what really piqued my interest in this sector was my dad. You know, my dad had some health challenges while he was here in Nigeria. And in fact, when they called me that he had passed away in the US, I just packed up all my things. I said, first of all, what am I doing here? If I have left my country for 20 years and no one is caring for my family the way that I would care for him, that really, tugged at my heart. And then I looked at, again, the life expectancy. I saw how we weren't investing in women, in children. I saw the labor force participation for women continue to drop in this country, and we are still expecting our GDP to grow. That is not possible if we are essentially keeping our women occupied with all the care work. In terms of what we can do, I think it starts with funding, professionalizing and formalizing the care workforce. And we have to actually start with healthcare as well, because that sector is already professionalized. Our doctors, our nurses are already professionals. So how do we make sure that they get paid well to do their best work and live their best life in this country? I think that is the puzzle that we need
There's
to
this research which says that women and girls in Nigeria performed most of this work and they are underpaid. How can we address this menace or challenge?
I think, honestly, fundamentally, it still boils down to valuing care as a society. A lot of us, because women have done this work for free, right? Think about it when we're growing up. Is that how you're going to behave when you go to your husband's house? You've already been groomed to cook, to clean, to care for everybody, right? And so that just goes on, even as we see more and more girls go, get better education. I have 3 degrees. And guess what? 99% of men in this country still expect me to be the one cooking and cleaning and doing all the things in the house. And so we are seeing that.
Are you saying,
are we bringing in the feminist agenda?
Season is changing?
And you can also see that the tide is changing. Our women are out there contributing into the economy, and we are still expecting them to shoulder 100% of the care work at home and in our society. Just look at the churches. When they call for volunteers, you will see the women there. The PTA, you will see the women there. But these women are also you and I, waking up early to be here at 5 a.m. And so what we are asking for is redistributing care. So how do we redistribute care? We redistribute it to men. Men can pick up their fair share. We redistribute it to the government. The government can support by providing universal childcare, support for our aging parents, support for our care workforce, investing holistically in care. What will it take to have working childcare centers, innovative childcare centers in this country so that our children can grow up with confidence and with resilience and contribute smartly into the economy?
You just mentioned distributing care even to men. So what are those things that men should do?
I think men can just start with doing laundry. They can just start with cooking. They can just start with taking their kids to school and picking them up from school. And we see that this actually works. When men invest in care in their home, they have better families, stronger families, their children love them, their wife wants to be around them, everybody is happy, and that contributes
So how do
to a
you
stronger
balance
society.
the workforce? Because you, as a man, you're out there looking for what they will definitely eat.
And
so,
the woman is doing that now too, sir.
So how do you do the balance?
I'm looking for what my family is going to eat. Why do you think I'm here? And we see this in the workplace. For example, we partner with a company called Providus Bank. And Providus Bank has been so intentional about retaining women in the workforce. Guess what? They have childcare credits where they offer a certain amount to any person starting a family. Similarly, aging care credits, so that those people can support their aging adults. Right. They also have care packages. They have return to work policies that work. Providus Bank is not the only one doing this. We see Standard Chartered Bank doing it. We see MTN doing it. We see a lot
You are
of
mentioning brands. You need to be careful with brands.
I need to be careful, yes. But
Yeah.
I bring this up because when we talk about redistributing care, it means that we can redistribute it to workplaces. I mean, you and I cannot go to work if we don't have somebody caring for our loved ones.
Very true.
If somebody calls you right now that something has happened to your child, you're going to leave this TV station right now. So what does that mean? It means that our organizations should be invested in our caregiving responsibilities.
Very true. So the organizations being invested is one thing. However, when you think about the fact that individuals, I think because you mentioned charity, right? The men need to be more invested in their homes because in the end of the day, it's their children, it's their wives, and as a head of the home, you're literally meant to be the major caregiver, right? Holistically. Now, I think, don't you think rather, the situation is even in addressing, because most times, even the women you're talking about that do more of the caring, they actually do that because more often than not, that is the option they have before them. So there's that situation. Now telling the man, so the man might see it as, okay, no, this is not for me. So now how do we get to the people and make them understand that, see, you are running to do care there, you will never do it in your home, but you need to do it. That's very important. How do we do that?
Before you answer that, let's add this as an addendum to it. What policies should be put in place?
Absolutely.
To ensure that we support the care
a
economy?
national care policy. I think that as a country, we need to have a strategy.
Okay.
We don't have a strategy, and we know the saying: if you have no plan, then you're planning to fail. And what is happening is that we need a care policy that really helps us design how we care for the new children that are coming in, babies that are being born into this country, our aging adults, our working population, and working families.
Okay.
That is where we need to start. We also need policies that professionalizes that workforce and ensures that our workforce is valued and paid well. Because when that workforce is valued and paid well, then families can actually get quality and accessible care.
Sure.
So that is on one end. In terms of telling the people, I don't think there's anything we can do about our people migrating. I really don't think so, and I don't think it's fair that we leave that option, we take that option off the table. I think what needs to happen is that we ourselves value those people, right? And that will prevent them. I know a lot of people that work in the oil sector, in the agriculture sector, in the banking sector here in this country that can never leave Nigeria because they're getting paid well here. True. So why can't we do that for our care workforce?
We hope that things will definitely get better in the country to ensure that the care economy is indeed, we see more synergy to improve the sector. We must say many thanks for joining us. Founder and CEO of Caring Africa, Blessing Adesiyan. Thank you so much for joining us on TVC Breakfast Saturday. All right, after the break, we focus on Osun politics as APC aspirants rally ahead of the 2026 governorship election. Do not go anywhere. We'll be right back.